Hi, I'm Dr. Gail Randall, and I'm joining my Instagram TV. We're going to talk about something really important, really unusual, highly unrecognized, and needs to be known about tonight on food allergies, environmental allergies, and other types of allergies. Very important to recognize because they can be life-changing and they can be deadly. So we want to be on top of it, we want to know what to do about it, and we want to know how to do it. And I'm going to tell you about it, what it means, what's happening. I'm going to tell you how to treat it, and we're going to lift ourselves out of this plague because we're going to know what to do about it and how to get tested, what are the best tests and things like that, okay? So, hi Suzanne, hi you guys, thanks for joining me, Teresa. This is going to be a great voyage we're going on right now. The first most important thing is to realize that food allergies and other types of allergies, environmental allergies, exist. So they've gone unrecognized and untreated for a long time, and we need to be more aware of them. And children have an incredibly increasing rate of food allergies, and people as well, but especially our children. The most common antigens for them or allergens are milk, eggs, and peanuts. Now, we can kind of understand the milk and eggs, but peanuts, and it's extreme allergy, and other tree nuts as well can be involved. Other allergens for all people are shellfish, fish, and really it can be about anything, but those are the top sellers as far as causing food allergies. So what's actually happening here is your body senses a certain antigen, let's say peanuts, and so it releases IgE, which is an antibody you normally have in your body, to control your immune system. So Teresa, I really need to get this point across right now. Do it later. And so the IgE seeks out the immune cells, the mast cells, and the basophils, and that releases histamine. That's what causes the damage. That's what causes the event. The potential deadly event, which is anaphylaxis. So anaphylaxis is a sudden drop in your blood pressure, dizziness, and there's only one treatment for that right now that we have, and that's an Epipen. So if you know you have a allergy that causes anaphylaxis, you need to have an autoinjector or an Epipen, and you need to have 2 of them. And if your doctor doesn't know that, you need to tell them, because and I'm going to teach you how to give it to yourself. So you need to have 2 because it's fine, very fine, to give yourselves 2 doses. If the first dose doesn't work, you need to know how to use it, and you need your family to know how to use it, and you need to take it with you everywhere, because sometimes you're exposed clandestinely, or in a, like something, peanut dust can be in a food and you don't know it, or an additive that you don't know of. So have 2 EpiPens, and you give it in the side of your thigh. And just the side, right up the side of your thigh, because the muscle is right there. There's very little fat, and it's very easy to get to your circulation there. You inject it automatically right in the side of your thigh, bisecting the knee and the hip, that space right there, and you should feel relief within a minute or less, 30 seconds usually. So if you feel like you can't breathe, you feel that you're dizzy, you're going to pass out from ingesting something, you turn red, hives all over your body, that's the time to use it. Because it doesn't hurt to use it if you don't need it. And then you'll get relief suddenly, and you'll be absolutely, thank you Olivia, that you'll be absolutely safe. So it's important to know that. That's simply the only drug for that event and the worst outcome. So going on from there, we need to say, well, what does this cost from? Why are there more allergies now? Why is it more prevalent? Why is there more children that have it? Well, 3 things, very prominent things are happening. First of all, our environment has changed. We have global warming and our environment. We used to live like on the farm with animals and dirt and soil and things like that, and our microbiome was much healthier. So our immune systems were healthier, and now we're inside in 4 square walls without anybody, lots of times, and not even without any other people. And that is bad for your microbiome, bad for your immunity, the changes in the environment, so in your environment. So and also the food on your table has changed. It used to be farm fresh, and it used to have a high degree of diversity. If you watch this guy Timothy Kirchville on Facebook, he's my friend, he's going to be on my podcast. He knows how to diversify his food. He keeps himself very healthy that way, and he shows it. He shows how to do it right there on Facebook. So watch him on there. And so food is different. It's not diversified anymore. Food comes with no bugs in it. It's all plastic wrapped, irradiated, microwaved. It has no bugs, so it's not repopulating our microbiome. It's ruining our environment inside. Our environment inside used to be what it was outside. Well, now that's not a good thing, because we also have this over-hygiene syndrome that we put upon ourselves. We wash our hands all the time. We use cleansers. We use masks. It's required of us as a population, but it is ruining our microbiome and making us more susceptible to COVID and all infections for that matter, and therefore more susceptible to food allergies. So it's an important thing. Now that we're getting more immune or safer, we really need to try to diversify our food. We need to try to diversify our people, that we start to be with more people, or have animals. Some of you have animals, which is a good thing, but they're over hygiened also. So that's not good for them. They need to be, with other dogs and other people as well, or their microbiome is getting too weak. Listen, we're born with a thymus, and the thymus is about in here. And by the time we're toddlers, that thymus has gone away, has completely involuted, and all those cells, those T cells, have moved into our gut. And they're in chains, I've told you this before, in Peyer's patches. And that is where your immunity resides. So why not address it there? We need to eat more diverse foods. We need to eat organic foods, maybe foods with a little bit of dirt on them, that come right from the farm fresh foods. So that's going to keep us more healthy, because we're degrading and deregulating our immune systems by eating the way we're eating and confining ourselves to the inside. It just it really doesn't work in terms of long-term immunity and safety for your body. So as soon as you can, get outside, walk around. So then what happens, your immune system gets a bee sting, or it gets a parasite, or it's exposed to smoke. It weakens it further, and you are not prepared for it. We need to educate our immune systems by diversifying our food and diversifying our environment. A third of people have allergies now. One third of people have allergies now. That's a huge amount of people. And they react to pollens and foods and all kinds of things. So that reaction where I told you, the IgE binds with the mast cells and the basophils, and the histamine squirts throughout your body, and then you get a reaction. You get a reaction, that's an allergy. That's what happens. And it can be very dangerous. Eggs, like when kids get allergic to eggs, which is common for them now, you got to not only look for, not give them eggs, obviously, but look for ingredients in food, such as albumin, globulin, lecithin, lysozyme, anything with the prefix of ovo, albuminate, and vitulin, all imply the presence of eggs. So make note of that. Many people are thinking milk allergy is a lactose intolerance, but it's different. Lactose intolerance is different than a milk allergy. Lactose intolerance is where you don't have the enzyme to digest milk. And that happens often in people of darker skin. I mean, we're all a little bit milk sensitive. We're all a little bit lactose intolerant because we really shouldn't be eating milk, honestly. But it can be worse than that. I mean, there's actual pus cells in milk up to 750 milliliters per, 750 pus cells per milliliter. That's astounding. I mean, even organic milk has that. So those things are gonna burst. They're gonna start an immune reaction in your body, and that can cause a milk allergy. So they're different. There's another kind of milk allergy, which is basically you get an allergic reaction to the protein of the milk. So there are many different ways to react to milk, but I don't think it's particularly good for you. Options are coconut milk, oat milk is my favorite, and almond milk. Those are much healthier for us. We won't react to another animal protein, and it doesn't cause a lactose intolerance reaction. So right now, they say that 7 to 10% of the population has allergies, food allergies. And the trick is like I said, is diversify your food. So don't eat the same things all the time. Make sure that you eat a variety of different foods, and you change it up, because you're educating your immune system by doing that. And we've all been so careful now because of, we think, oh my God, the food allergies, and so we're so overly careful in choosing food. We need to broaden it out a little bit. Don't eat foods that you think are not good for you, but you need to eat a diverse food menu. And if you're reacting to milk, even goat milk, because the protein is different, you're going to end up getting it to that. So I wouldn't recommend changing to another animal's milk as a remedy for that. The skin actually plays the largest role in food. Isn't that weird? In food allergies, and especially as for little kids, they run around naked a lot. But every place the skin can touch the air is a potential for an allergy starting in your body. It's true that all people that have eczema have allergies, but not all people that have allergies have eczema. And they probably originally got their eczema by peanut dust or pollutants or smoke getting on their skin. So that's what you need to try to beware of. You don't know it, but oftentimes people have small tears in their skin, and the allergens get in there and start what's called the alarm pathway. And that's how babies with eczema get allergies, because their skin is already exposed. The allergens get on their skin, and boom, takes off even more. It's really sad for those people. So immunoglobulin E binds to the food antigens. The food allergy, binds to the food allergy complex, binds to the mast cells and beta cells that circulate throughout your body, and it releases histamine, and there you're off and running with a severe allergy. So we already discussed anaphylaxis. So there are, the immune system needs to mature with allergens on board. The immune system cannot mature if you are in a immune, like a bubble, like the boy in the bubble. You wouldn't get a mature immune system. So, like I said in the beginning, you need exposure. Your immune system needs exposure in order to be healthy. So, not all people have food allergies, but 80% of people with eczema have food allergies. It's from the little tears on their skin that the allergen gets in there. So what you can do sometimes is do desensitization therapy through a vaccine kind of thing. Sometimes that works for people. Anti-allergy foods, I like to go this way because it's natural, are apples, quercetin, because apples have a lot of quercetin, and turmeric, which is anti-inflammatory, garlic, which is antioxidant, lemons, flaxseed, salmon, which I don't normally say to eat because the fishes are overfished in the ocean, and we had the lowest number of salmon this year ever. And don't eat farmed salmon because it's got those toxins in it. Green tea is very good. Oranges are very good. Sweet potatoes, ginger, and collard greens. So those are some of the natural ways you can treat your allergies. When we were hunter-gatherers, way back when, and what the earth was, we were, it sounds strange, but insulin resistance was protective. Isn't that interesting? And having small little allergic reactions was protective. Sorry about that. But it's no longer that way. So they invented, this is funny, the same person that invented the Epipen is the same person that brought the apple trees to Washington. I think that's cute. So the Epipen's been serving us for a while. And it is the only drug that can stop the reaction. And I described how to give that earlier. Now what we're working on, we got the ambulances to begin to carry the EpiPens, but now we need to get the EpiPens into the schools, into the gyms, into the school nurses and things like that, because we could save a lot of lives that way. So if you get a really bad reaction, the symptoms are wheezing, trouble breathing, hives, redness all over your body. That's when you choose to give the EpiPen. If you have wheezing, trouble breathing, and hives all over your body. You don't want to wait till your blood pressure plummets and you have the inability to breathe, because that's a little too close for comfort. Some people have food allergy, but not others. So that's kind of interesting. So some people have allergies, or some people just have IgE reactions. They're similar, but they're not the same. And the reason I mention it is there is a drug called otulimab, which does treat the IgE reaction, but not full-on like the epinephrine. There's another drug they're trying called Zolar, which just blocks the IgE. So there's two different ways. Go after the IgE, or go after the histamine with the EpiPen. And you really should have an allergist if you're at that level of figuring it out. you need to go to a board-certified allergist. A lot of people have a lot of guilt around this, so I want to address that because there's no guilt needed. A lot of women are guilty mothers because they think, oh, I ate peanuts during my pregnancy, so I gave my daughter peanut allergy. That's not how it works. You are not the one to blame here. So just help your child get to the right professionals, and you can get a hold of this. Get a hold of some Epipens and keep them always with you, and get the kid, either the kid or an adult for that matter, tested. Okay, so this is another thing you need to know. What are the tests that I should get done? There's skin tests, there's blood tests, there's food challenges, and there's food sensitivity tests. And there's a difference between food allergies and food sensitivities. So the skin tests are something that's done by a board-certified allergist. If you have allergies, you've probably had it. And they make a bunch of little scratches on your skin, and they find out what gets the worst reaction, IgE reaction. There's blood tests, which test your blood to look for IgE to certain antigens. That's a good test. Again, you need to go to a doctor for that. Don't do it at home. They have these kits they send out on the internet, and those are not accurate. Oftentimes they overread the allergy, and you need to have somebody that understands that. There's the food challenge test, which is accurate, but that does also require a board-certified allergist because it takes 5 or 6 hours, and you need to be in an allergist's office and there with personnel that know how to treat you if something happened. And then there's food sensitivity tests from educated doctors that know how to work in this area, and it tests both IgE, tests both IgE and IgG. So it's a blood test, and you can sort out, do you have a food sensitivity or do you have a food allergy? And I like that one very much because it also tells me the condition of the gut. When I see a food allergy test that has all IgEs and all IgGs pan positive, they have a leaky gut. And I know how to fix that. So that's, go to a gut doctor. That spells gut to me. And then there's the piece about vitamin D. Very interesting. The prevalence and increased distribution from allergies has just gone wild in Australia and countries like that because they have such a high incidence of skin cancer. They stopped putting on, they started putting tons and tons of, skin cream for skin cancer on their bodies, and thus they developed very severe vitamin D deficiencies. Horrible. And then they were the prevalence of food allergies just went crazy. So, you want to put on the sunscreen, definitely, but you have to take vitamin D. You need to do both because it's one or the other. If you just do the skin cancer treatment with the sunscreen, you're going to get totally deficient in vitamin D, which has a great impact on mental health, has a great impact on whether or not you can resist COVID and any kind of infection for that matter, and inflammation. And inflammation in conditions like Parkinson's and Alzheimer's and other neurodegenerative disorders has gone way up in Australia. Now they're getting it. They're starting to give vitamin D. and use the sunscreen at the same time. So that's a good thing, right? Okay, so that's what I wanted to share with you. I want to say one other important thing about allergies. I don't know if any of you have gotten vaccinations or any of you have gotten reactions to vaccinations. There are people who have gotten the vaccinations and have not gotten reactions to vaccination. There are people who have gotten the vaccinations and had reactions to them, and the reactions to them are basically an allergy. If you look at the symptoms, for instance, excuse me, if you look at the symptoms in, sorry, if you look at the symptoms to vaccine reactions, the most prevalent one, of course, that scared us all in the beginning was anaphylaxis. Well, what is anaphylaxis from? It's from acute over-response to an antigen. It's an allergy. Okay? Those people went down, and then there were the lesser reactions. People with fevers, people with rashes, people with other types of symptoms like imbalance or weakness, and they're all in the same lineup with allergy, with food allergy or environmental allergy. Because environmental allergies from smoke, from toxins, from pollen are the same reaction with the basophils and the mast cells and the histamine as is food. And it's the same with the vaccines. And they have a number of chemicals in them. You can look those up. They're too complex to present. But it could be the chemicals. It could be the actual antigen, because maybe people had small cases of COVID and they didn't realize it. Or maybe people had COVID and they realized it and they still got the vaccine because that's what we were instructed to do. So I wanted to mention that, not to deter you from getting one, but to inform you that, you know, if that happens to you, that's what's happening. Okay? So do wait that 30 minutes they ask you to wait, because if you're going to get an anaphylactic reaction, it's going to be in the first 30 minutes of exposure. And then if you're okay after 30 minutes, you're probably okay. You know, you might have some sensations like itching or rat or other things, headache, sweating, fevers, but you're not going to die, okay? So that's the story, and if you have questions now, I'd like to take them. No more questions? Somebody wanted to come on with me. I would entertain that now if you do. But I wanted to get my speak out. Okay, guys, you want to end early? I thought we might have a lot of questions on this one because it's so different and unrecognized and very needed. Okay. All right. I love you guys. Thanks so much.